other than this hate-mongering people like Rush Limbaugh, I want to know why we're so afraid of nationalized health care. I've had nationalized health care.
Here's part of the concern. You know, the public health care system, and again, we have a lot of government in health care. I mean, if you're on Medicare, that's a government program. It's not just a question of service or TRICARE. Medicare is a government program. But remember, a lot of the public health care system is financed not only with taxes, but with private health care paying more for essentially the same service. If everybody moves over, you know, then the taxes are going to go up, and this is kind of to this lady's point, what happens in a place like Canada is some sort of rationing takes place. It's pretty hard politically to pass higher taxes. It's pretty easier to make you wait 3 months for care that you might get immediately in a private sector.
In our current situation, no amount of money is going to really correct the crisis that we have unless we change people's attitudes towards more healthful living. So my question is, what are you doing at the governmental level to encourage people, to encourage schools, agencies, to promote better health and move back this crisis that we're in?
That's a huge part of our problem. You know, our preventable endemic illness. It's your choice whether or not you choose to smoke a cigarette, but it has real health care consequences for you. You know, it's your choice whether or not you choose to try and, believe me, I clearly obviously struggle with weight, but you know, that's a personal choice. But these things have huge social consequences. So incentivizing, you can't penalize people, and you can't make people do or not do certain things, but you can try and incentivize them, you can try and educate them. We're trying to do more and more of that. I think both the private insurance and private companies have figured out it saves them money for you to be healthy. We need to incentivize it in ways where it saves you money.
So my question to you is, if I lose my job tomorrow, I work for Southwest Airlines, I'm very pleased with my health insurance, it's very good. If I lose my job tomorrow and I have to go on my husband's insurance, he's with Blue Cross Blue Shield at the University of Oklahoma, we would have to pay out of pocket at least $1,200 a month. That's counting my pharmaceuticals, the increase in the premium. Why should I believe in status quo when we obviously need reform?
I mean, I think there's a national consensus on that. So, you know, I think you're right. The argument is over what kind and whether or not, for instance, one of the points you touched on, whether or not the public option is real, quote, reform. Is that a fallback position that you're always safe no matter what happens? You know, I think we actually have another model out there that has shown that it works pretty well, and that is Medicare Part D. It's not perfect, but I got to tell you, if this were 2003, before Medicare Part D happened, because believe me, I had town meetings, and they weren't this large, but they were always full of senior citizens that were really upset because they couldn't get prescription drug care.